Do you second guess yourself when you are taking an exam or a high stakes assessment? Do tests increase your anxiety in a way that makes it hard for you to comprehend the questions that are being asked? Do you spend hours on your studies and still don't get the results that you are looking for? Get the support that you need to help you get the grades that reflect your efforts. I am here to support you on your journey. You can utilize the podcast, set up tutoring sessions, get some streamlined study sheets, or just get some advice on how to tackle testing in dental hygiene school so you can put those really important 3 letters after the name that means so much to you. The Happy Flosser is here to support you to make your path to becoming an RDH a reality. Links to many helpful resources are in the show notes of each episode. Have you checked them out? Perhaps there is something there that may help you. Happy listening. Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene, to support you on your journey through the dental hygiene program. It is so great to have you with me today, and I'm so glad you're listening. Today, I have a special guest, Donna Murray. Donna is a fantastic, high-spirited dental hygienist that I have had the pleasure of speaking with and getting to know a little bit. So I am so excited that she's taking the time to share a little bit about herself with you. So welcome today, Donna. How are you?
Very well, thank you. Good morning, Billy. Good morning, everybody else that's on this listening today. I'm very grateful for you, Billy, for having this initiative for this podcast. As a dental hygienist, back when I was younger, anyway, it wasn't a thing. So I think this is a great initiative to support dental hygienists. So thank you, and thank you for the invite.
Yeah, absolutely. Yeah, we didn't have podcasts when we were young hygienists or in school. So this is such a great way for us to share some of our knowledge and insight with the next generation of hygienists. So I'm so happy you're with me.
Thank you. Thank you.
So I think the best place to start is with your journey, how you became a hygienist and some of the things that have unfolded along your way. So why don't you start there?
Okay, sure. As many that we come into contact with, and I know some of your prior guests have spoke about the same thing. It wasn't a planned thing. When I was in high school, initially, I was thinking more like childcare. But then I had an experience that just kind of changed my life. And I grew up, dental care wasn't a priority with my family. So I had an emergency visit to a dentist, and he found multiple cavities and recommended some root canals, and then all that comes with the root canals and some other things. At the time, my mom wanted my teeth to be extracted. I was 16. And fortunately, the dentist, he got me numb in just the area that I was having a problem with. And then he's like, no, we can't do this. And so he proposed to me. He said, Donna, I do not want to extract your teeth for X, Y, and Z. And all of you listeners here, those X, Y, Zs that happen when we pull teeth. So he said, you're only 16 and I don't want to do this, and you have a lot of work. So how about, Donna, if I do all your work for you? Root canals, crowns, extractors, surgical, wisdom teeth, like the whole gamut. He says, and in exchange, you can come back to my office and work it off. You can do some pulling charts, you can confirm patients, you can clean things up a little bit, whatever. There was some babysitting with his kiddos that came into play with that too. That was good. So that was our agreement that I did. And so he worked around my school schedule. So I worked there doing a variety of things for a few years. It took me a couple of years to pay that off. And in the meantime, he always included me in his office continuing education. Come on with us, Donna. And he would pay for everything he paid for the whole staff, and he always included me. He was a little small independent practice in Connecticut. He's still practicing today. So I am very grateful for him because that was my first introduction into oral health. And then I decided to go to hygiene school. And when I was in hygiene school, I would still work for him. Then I was getting a paycheck at that point. And then eventually when I graduated from dental hygiene school, I worked for him for a little while I was in Connecticut. So at the time, I did not realize that he was a public health minded individual. And now here we come full circle. I am back into that public health realm. So that's how I got into the field of dental hygiene.
That's an amazing story because he was teaching you things that you didn't realize that down the road you were actually going to like pay it forward to others. Oh,
Mm-hmm.
I love that
Absolutely.
story.
Yeah. His name is Dr. McKay, Michael McKay, and he's still in practice today. Same exact was back then. For you listeners, like it was not an uncommon thing. When I was growing up, dental offices were in a house setting.
Yeah.
Now rare that you see something like that. So,
Yeah.
yep, he's still there.
Yeah, and so oh my goodness, I have so many questions after hearing your story. So as a 16-year-old girl, here you are, you show up and now you're working off all of this work that you've done, and that really helped create value around your
Mm,
dental services for you to
ab-
understand that. Yeah. And so
yeah,
how did you go from there? And so when you first became a hygienist, you weren't in public health, right?
correct. I
Yeah.
was not. I was not. But because of my experience with Dr. McKay, um, I knew I wanted to be in different environments, practice in different environments. So I applied to 3 hygiene schools. Initially, I had my heart set on one in particular because of it was really close to the beach. Okay. I was a young girl, so not initially. But then when I started to go through my interview process, which I'm so grateful to hear, Billy, that still takes place in your program.
Yes.
Other programs that I speak with that isn't part of the process. So anyways, so I went to some different interviews and eventually I landed with the University of Bridgeport Phones program.
Mhm.
And I love their idea with their community rotations.
Mhm.
Other schools offered it too, but theirs, coming from the small town that I was in, there wasn't a lot of diversified populations that I was seeing. So when I went to Bridgeport, I was like, whoa, I didn't realize this existed. I didn't know that people were living, a different type of lifestyle than small town little Connecticut that I was in, isolated. So that exposed me to public health. And for our listeners, I know many of you have read the book by Mariotto, Teeth, Public Health, and that school is where it all started. So that's how I got more exposure to public health. So I ended up getting my bachelor's. So for students, I would strongly encourage you to move on after you complete your associates to get your baccalaureates. And then I practiced in hygiene for a little bit, well, a lot. But then eventually I moved to Pennsylvania and I applied for graduate school and I got my master's degree in public health from the University of Bridgeport. And at that time, I was trying to figure out, here we are, still trying to like figure out public health. How do I get in there? What is there out there? And so I did graduate, with my master's in public health. What do I do with it? What do I do with it? Like I can recall, perhaps some of our listeners, they hear this too when I was in school, talk about the different roles of a dental hygienist, the different areas that are out there. How do you get there? And at that time I didn't know at that point. So I worked in private practice for one particular practice for a long time. And eventually I had an opportunity to work with what's called an MCO. That's a managed care organization. And there in your state, in New Hampshire, I know, just for listeners who may not be familiar with managed care organizations, that's an organization that's Medicaid, Medicare. So in New Hampshire, those plans are AmeriHealth Caritas, which is the one that I worked for in Pennsylvania, AmeriHealth Caritas. You have New Hampshire Wellness, I think it is, and New Hampshire Healthy Families. I have a note here. Healthy Families and WellSense Health Plan. Those are the three MCOs in your particular state. So I worked for them. And there are lots of different roles within an insurance company that a dental hygienist has the opportunity to work. That particular program, I was a navigator and a project manager. So again, that brought me into the public health realm because I had an opportunity to see individuals that were underserved and the vulnerable populations that today graduates, students are hear more about that than when I was in school. So that really exposed me and again, brought me into the public health circuit. So today, I worked there, public health for a while. And then I came upon a job working for a school district. And that's what I do right now. I work for a school district as a dental hygienist.
Yeah. So what's a typical day working in the school district as a dental hygienist?
Yeah. Yeah. So there's a lot. I'm the only one. So I'm my own boss. But that's okay. I do have a great support system. I have a wonderful director and I, run things by him. He's like, yep, 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 yep. So, so a typical day, I provide what's called the mandated dental screenings for the students. So for our listeners, if you recall, when you were in school, you go home with a dental form and that has to be completed by your dentist and then you have to bring it back. So for students that don't bring back that form, then I'm the eyes that look in the kiddos' mouths and provide that screening. And then I make sure kiddos get to the dentist. So a typical day for me, I do dental screenings for isolated grades I start with. And I see a lot of, here we go, back with the inequities that exist, access to care problems that are out there, because I see kiddos that their teeth are just blown out. Abscesses, fistulas, and I have to try and find care for them. So that's part of it, screenings, part of it, I do have mobile equipment. So for kiddos that don't have insurance or access to care, I provide preventive services for them and get them to a dental home. That's the main thing. So for listeners that are thinking, oh, I want to be a mobile provider, that's great because we can go out into areas where kiddos' families don't have oral health care, but the ideal setting is get them to a dental home because I can't do a filling. I can't pull a tooth. I have to work within my scope of practice. So I do that. And then I do education in the classrooms. And that's a lot of fun too.
Wow. So Donna, you're shining the light on two really big things in my mind. Number one, we need to do a better job at helping students that desire that pathway of public health, creating a clear pathway for them. So it sounds like you've navigated your way all the way back to where you really wanted to be at the beginning because there wasn't a clear pathway designed for you from maybe the educators and the policymakers and the people that are developing and dictating the scope of practice. And then the other piece is the the need that exists is still, we forget that the need is so big. And I think when we get out there and we're not in public health, we just start planning treatment, people have it, and then they go on their way and we continue. But when you expose the need, it really makes you realize that there's such a desire and a demand for us to really focus on this a little more.
Mm-hmm. Yeah, yeah, absolutely. There is a need, and it goes beyond, like right now we hear workforce, and that's a whole national thing, right? So even, getting dental professionals within the traditional dental setting, that's hard. So then we take it to the next level where, people don't have access to care, getting them in those particular settings. For me, one of the other pieces, I certainly, got a little bit, I got public health coursework when I was in hygiene school, when I was in graduate school, and then trying to navigate that. One of the things that I would suggest to your listeners, um, once you graduate, once you pass once you get through all these, pieces that you may be stressed out with, once you get that completed, and Billy, I know you've mentioned this on prior podcasts about getting involved with organizations.
Mm.
So one of the things I would recommend to our listeners is there's more out there than the American Dental Hygiene Association. Okay, yeah, this is where I got that pen. So I was a member of that for a long time. And I know my experience is, SADA, that's, encouraged for students as well. But there's more organizations out there, additional organizations that are just wonderful. And I was really surprised once I found out about some of these organizations, like you're talking about dental.
Yeah.
Wow, I didn't know that. And I got that exposure through working for the NCO. For example, I became familiar with Pennsylvania Coalition for Oral Health. Other states have oral health coalitions as well. And the first time I went to one of those meetings, there were doctors in the rooms, there were nurses in the rooms, there were representatives, our legislate, like whole gamut talking about oral health. And that to me was like, I love that.
Yep.
Love that. Because when I would go, and I go, when I go to, typically when you go to a dental meeting, not just in the sense of just, but it's an isolated group. It's a closed group of dental professionals. Whereas when you're getting involved with these other organizations, you get to hear other things that are going on, and there may be opportunities for an individual to get involved with a particular project. So coalition groups is something I became familiar with. Also, for our listeners, the American Academy of Pediatrics.
Mm.
Take a look at that website for listeners, for students, and you might be surprised to see they actually have a oral health webpage. So that was something else that I was able to get involved with, and I'm still involved with that. And that piece of involvement is I go out to medical offices and teach, help them learn to look in the mouth of our kiddos. They can't diagnose, right? Because dental hygienists, we can't diagnose either, but certainly do a screening and you see something going on. So I go into the medical side and show them what's normal, what's not normal. And then also um, guide them for applying fluoride varnish. So, for our listeners that aren't familiar, there are many states now that medical providers at pediatric level, once they take a certain course, um, they can apply. They're doing screenings, they're applying fluoride, and they're getting the kiddos to the dentist. And now some of them are doing silver diamine as well.
Yeah.
So there's lots of different organizations that typically um, many of my colleagues don't realize that are out there, and they're talking about oral health, and that's really exciting for me
Yeah.
to hear.
Yeah, it changes your perspective, which I think that's a good challenge to put on students to say, how can you have an impact and increase the knowledge and have a seat at the table so that you can share with others that are also working with these populations in a different capacity to be more comprehensive across the whole person. I love that.
Yeah, it is. There's lots of opportunities, and then we learn from them as
Yeah,
well.
we
You know,
do.
one of the pediatric offices that I was in, the pediatrician and I became very good friends, and she made a recommendation for me to read a book, and it was one of my favorite books, and it talked about something called the social determinants of health.
Hmm.
Um, do you talk about that in your program, Bill?
Yes, and I studied that a lot at UB when I was doing my master's degree, and I have my bachelor's in sociology. So I think sometimes we overlook that on our side if we're not in public health.
Right.
Yeah.
Yeah. Yeah.
We do
So,
teach the students that when they take their community health piece, it is talked about for sure. But I bet I bet it's looked at a little different from the medical side.
mm-hmm. Yeah. Yeah, it is. And so you get, to have that exposure and to hear, other things that are going on, even within um, a school setting. Sometimes, like, I'll come across something that's going on in the mouth, and I think, need to get, but then there's something else going on at the home setting that just changes that arrow a little bit. And for our listeners, if you ever have an opportunity to get involved with Head Start,
Mm.
there's another oral health component that they have with it. So, that's another area that students, our colleagues, they're going to be
Yes.
they're our colleagues, right? Um, get involved with.
Yeah, for sure. Those are all such great suggestions for maybe a student who has done their community rotation and they have it in their heart and they're thinking that community health is something that they're interested in, some kind of public health movement, is getting involved with the oral health coalitions, getting involved with their local, some of the community events that take place that are including medical providers and dental providers together. That's such a great idea and suggestion. Thank you, Donna.
Sure.
So, one other thing I just want to ask before we wrap up is because you've just had such a great journey as a dental hygienist. I love how you came into the field. I love how it's become a full circle and now you're giving back to these kiddos. I wonder if you'll have an opportunity to have a kid, pay you back for something you do and then bring them in to be a hygienist. I don't know. But I can't help but wonder, so what would you tell yourself if you were a student just about to graduate, now that you've had all of this experience and all of this um, really wonderful, enriched career, what would you tell yourself just starting out?
Yeah, I think I would say listen and act with your heart.
Mm,
And that is something that I knew, like, from the start, that there was not some, there was an attraction to public health, but again, I wasn't sure how to navigate that. Eventually I did. So for students, I would say listen and act with your heart wherever you think it's going to follow you. And then try to look not just with your eyes, but again, with your heart. And that's something that I have two daughters, and they help to like really bring that home to me. When they were when they were in high school, I had one daughter, she's artistic. And so her circle of friends, they were wonderful kids. But her circle of friends, initially when I looked with my eyes, I was like, not sure, not sure. Because again, here we go back to like my growing up, my exposures, like my little silo.
Yes.
Um, but then my daughters, they just taught me like, mom, just because like doesn't mean like if they're doing things that don't align with me, I'm not going that path. They're not, I'll pull away from them. And that's exactly what they did. So, today I just give a lot of credit to younger people because they're, to me, they do seem to be just looking with their heart and doing and leading the lives that they want to lead, as long as you're not harming an individual isn't harming themselves, harming others. Just listen to your heart and go to that direction. So for our students, that's something that I would encourage you to go beyond your entry level associate's degree, because that will offer you additional opportunities. And whether it's in private practice, which is great. I'm still in private practice as well. But it offers you other opportunities to share your knowledge and learn from others. I work with a lot of younger dentists too. And it's really inspiring. It's real to see all the cool things that are out there right now that they're doing.
Yeah. Oh, that's such great advice, Donna. I I just want to thank you for taking the time and coming on and, following your heart to share your journey and share some of the, nuggets of lessons that you've learned along the way as you, inspire the next generation to push themselves to be their very best. I love that.
Thank you. Thank you for this opportunity. And listeners, I'm sure is there a way that listeners reach out to you, Billy?
Oh yeah, all of my contact information is in the show notes. I was actually going to say, how would they reach out to you if they wanted to contact
Yeah,
you?
I can do that one or however works best for you. I'll just leave it at that. Whatever
Okay.
works best for you, Billy. I'm more than happy to share my contact information and talk a little bit more one-on-one with our dental professionals, our students, and our colleagues that are listening to your podcast as well.
Okay. So I'll put your email and contact information in the show notes for our listeners. Thank you so much, Donna.
Thank you, Billy.
All right.
Thank you.
And to our listeners, thank you so much. I always look so forward to hearing how this podcast is inspiring you. You can always continue to send me messages, and I will just keep hitting the record button. Have a great week, everyone. Be sure to subscribe to this podcast so that whenever a new episode launches, you will get a notification so that you can take little steps towards learning all that you need to know for dental hygiene school. Take care, everyone.